Hey y'all, this is Jet here from Clinical Research and Tea with Jet. If you haven't been paying attention to what's been going on with the Trump administration this year, RFK Jr. has been in the hot seat over his responsibilities as the Secretary of the HHS. In this video that we're about to watch, Senator Murphy from Washington is questioning RFK Jr. about the allocation of funds. So let's watch.
In this Congress, Secretary Kennedy, things are not going well. It's clear what you are doing across HHS is devastating to children, families, seniors, millions of Americans that HHS programs support. Now, you were required to send us an...
So this is Senator Patty Murray. She has served as the Democratic U.S. Senator from Washington since 1992. Throughout her tenure, she has played a significant role in advancing health-related legislation. In 2014, she was instrumental in the passage of a bill ensuring that rape survivors have access to emergency contraception. Additionally, Senator Murray has previously challenged the Trump administration over healthcare policies, particularly criticizing efforts to promote what was described as junk insurance plans that could undermine protections for individuals with pre-existing conditions. Senator Murray is now the Vice Chair of the U.S. Senate Committee on Appropriations. HHS stands for the Department of Health and Human Services. Their mission is to ensure that health and well-being of all Americans by providing for effective health and human services by fostering sound, sustained advances in the sciences underlying medicine, public health, and social services. Now, Secretary Kennedy is the head of the HHS.
Operating plan detailing how you are spending funds that Congress provided for programs that families rely on. You sent us what you titled the quote Hill version, which had over 530 asterisks in place of the funding levels. Mr. Secretary, we need the real version with actual funding levels. This committee needs to know how you are spending taxpayer dollars right now and what programs you are cutting and which you are eliminating. You are blocking billions in funding that Congress appropriated from going out the door, including $3 billion at NIH, $1 billion in Head Start, and $3 billion in child care funding alone. And that's on top of all the other funding you have illegally ripped away. $11 billion from state and local health departments, $1 billion supporting local substance use and mental health programs, and $66 million in Title X funds for cancer screenings, birth control, and preventive care.
Okay, so if you haven't been doing the math, this is $3 billion in NIH, $1 billion in Head Start, $3 billion in child care funding, $11 billion in state and local health departments, $1 billion in supporting local substance use and mental health programs, and $66 million in Title X. So that's a ground total of $19.66 billion in funds that he needs to account for in these programs.
We know you're dismantling HHS and throwing away generations of investments in our healthcare system and firing critical employees. We're talking about the people who administer Head Start, LIHEAP, Meals on Wheels, or entire teams who are working on preventing chronic disease and Alzheimer's, tracking IVF success rates and safety, maternal health, more. On top of all of this, you propose a budget now with truly devastating cuts that would leave America sicker and weaker. But you're not waiting to see whether Congress
Make America healthy again.
Approves that budget proposal. This administration is starting to unilaterally implement it right now in defiance of Congress and the laws we passed. If you aren't already, you're sprinting down the road of illegally impounding billions in funding through intentional action and incompetence. So to my colleagues on this dais, We heard several weeks ago from experts across the country what we risk by ceding American leadership on biomedical research. If we bless these staffing and funding cuts across HHS, that means deciding that we are comfortable with China leading the future development of every drug, device, and vaccine. The supply chain challenges we faced during the
So, due to the funding cuts that we've been hearing about, and will likely need to source medical and pharmaceutical supplies from other countries, as she was talking about with China, which means paying these tariffs that they keep telling us that we're going to start paying soon, potentially as high as 25%. I recently released an episode discussing how this impacts pharmaceutical costs in the US and covering additional related issues. So tune in to that. You can go back on my channel and look for that if you want more information.
pandemic will be the new normal. Our access to the latest treatment.
Sorry, I cut her off on that earlier, but she was talking about the supply chain challenges from the pandemic. So as a reminder, they're referring to the process involving in sourcing, producing, and delivering goods and services, including staffing, supply management, manufacturing, and shipping. So as we saw during the pandemic in 2020, a lot of things happened where we either had a shortage of staffing. We also saw that, it was hard to get products out and services because of those staffing challenges, as well as being able to manufacture things in time. And so a lot of delay happened, prices went up. We don't want that again. We already dealt with that nearly 5 years ago. We don't want that again. We definitely don't. So we need to figure out how we can avoid that.
And cures will depend on other countries. It's time to stand up and assert Congress's authority. This committee has dedicated itself in a bipartisan manner over decades to make sure we are the global leader in research and development. And now all of us know this administration is now setting us back where it may take decades to regain that position. If we don't, decades of scientific breakthroughs and medical discovery and the bipartisan work to support them risks being burned to the ground, and it will be very, very hard for us to rebuild that. We should be setting this country.
And, there's a saying that says it's harder to get things back when you lose it. Keep that in mind.
Up for failure. We have to do better. Now, Secretary Kennedy, listening to your testimony last week, frankly, left me pretty confused and concerned about what is happening at your department. You repeatedly claim that staffing and funding cuts that have been reported on publicly and even confirmed by your department staff are not happening. So either you're lying or you're not the one making the decisions. You said, and I quote, "I made sure that Head Start was not cut." Later going on to say, there should not be any delays, the funding is there. Well, Mr. Secretary, HHS is delaying billions in funding for Head Start and child care. These funding delays meant that a Head Start program in my state that serves more than 400 children had to close its doors and left parents scrambling. So let me ask you about another child care issue. Secretary Kennedy, whose decision was it to withhold child care and development block grant funding?
Senator, I want to point out that in 2021, at the beginning of his administration, President Biden submitted his budget on May. You know what? You made an accusation of me, and I'm going to answer it.
Okay, I appreciate
On May
that.
28th, he submitted his budget. So our budget. We're a new administration.
Okay, you can.
And I also want to point out.
I have just 2 minutes left. I asked you a specific.
I want to
question.
point out something, Senator. You presided here, I think, for 32 years. You presided over the destruction of the health of the American people.
Well,
Our people are now the
Mr.
sickest people in the
Secretary,
world.
seriously.
Because you have
Mr.
not done your
Secretary,
job.
seriously.
So he wants to blame the other administrations for why our country is supposedly the sickest country in the world. How is withholding or cutting funds in the current administration fixing the problem? Anyways, I looked it up. So according to Statista, we are the 69th healthiest country in the world. Not great, but not bad either. So, however, not surprisingly, Central African Republic is shown as 167th on the list. So obviously we aren't the sickest. And if he keeps doing these budget cuts, there's no way we can get any healthier. I'm just saying.
That is an
What have you done about it? What have you done about the epidemic of chronic disease?
Mr. Secretary,
what have you done about the epidemic of chronic disease?
Seriously, Madam
Secretary,
Chairman.
I would ask you to hold back and let the senator ask the questions.
So, I mean, obviously this shows some unprofessionalism on the secretary's part, but I'm glad that Senator Murphy was able to redirect him and the Mrs. Chairman.
Mr. Secretary, I'm asking you a question about child care. I'm asking you who made the decision to withhold child care and development block grant funding.
That was made by my department.
Okay, and you said last week, quote, we were not cutting thousands of scientists, we are not cutting clinical trials, but I want you to know in the last 4 months, you fired or pushed out nearly 5,000 NIH staff and terminated more than 1,600 NIH grants. That includes more than 240 clinical trials across the country. So whose decision was it to fire scientists and terminate these NIH grants and the clinical trials?
Senator?
So that was, she said 240 clinical trials across the country. Now, I don't know how many of them were actually cut, right? But that's a quite significant number, and there's definitely a lot that were cut. I know personally when I've tried to get a job with a clinical trial recently, I've been getting some rejection letters, if you would call it. But they basically were stating that they were no longer fulfilling these positions, and I can only imagine it's because of these cuts. Now, I also have a friend who's been working in a clinical trial, and she just recently lost her job as well because they put a freeze on their clinical trial. So now she's out trying to find a job. And when I've been searching on LinkedIn, I've also seen posts from fellow colleagues in the departments that also have lost jobs that are also looking for jobs. So he's definitely done some cuts, whether he's willing to admit it or not. People are losing their jobs.
I don't trust your information with all due respect. You told me 3 days ago or 4 days ago that we had cut a clinical trial in your state, and what you said turned out to be completely untrue, and you knew it was untrue because you corresponded with Jay Bhattacharya before
Madam
that.
Chairman, I will answer that. It shouldn't take me, first of all, raising an issue with you face to make sure NIH is working its way through this. The woman that was in question, as I clarified to you at the last committee, was qualified for a clinical trial, unlike you stated. So
Untrue. Untrue.
No, that is true.
Untrue. She qualified this week. We shouldn't be talking about patients' private information.
I agree.
Anyway.
And let's leave.
He did get something right there, saying patient information shouldn't be addressed because it's a HIPAA violation. I'm just going to leave it right here because there's not really much else going on. He kind of doesn't really answer her questions. He just wants to basically make excuses and say that it's the other administration's faults for why we're in the position we're in. But all she wants to know is, where are these funds? If we have these funds set up specifically for these programs and services and they haven't been accounted for, well, you need to account for them. So I'm glad that Senator Murray here is holding him accountable. So what are your thoughts? Let me know in the comments below. And please support this channel by liking and subscribing. I will be taking a closer look at what will be happening as we continue to watch Robert F. Kennedy Jr. and what he's doing in the White House. Until next time, have a cup of tea for me, and thank you for watching.